Hello, my name is Alan, and I will be performing a cardiovascular exam on Dayton Tamita. Alright, Dayton, I'll be placing this blood pressure cuff around your arm, 1 inch above the antecubital fossa area. Okay. And then for this process, make sure your feet are firmly planted on the floor, and please don't talk. I'm just going to find your occlusion point for the first one. So I'll be placing this right here. Okay. Keep your arm in full extension if you can.
Okay.
Thank you. So that was right about 135, and I will add 30 millimeters of mercury on top of that to find the occlusion point. All right, I'll be placing the stethoscope right below the cuff, and then I'll be bumping this up and taking your blood pressure. All right, Dave, your blood pressure was 145 over 67.
Okay.
All right, Dane, now I'll be assessing your blood pressure while standing.
Okay.
Please keep your arm in full extension, relax, and please don't speak during this process. I'm going to be placing the stethoscope right below the blood pressure cuff, and I'll be listening for your cord cough signs, all right?
Okay.
So just relax for me. All right. So after releasing the blood pressure at 2 millimeters of mercury per second, your blood pressure was at 146 over 68.
Okay.
All right, Dane, for this next one, I'm going to be assessing your pulse for the next 60 seconds.
Okay.
Okay? So go ahead and just relax for me and breathe regular. Okay? All right, that was 60 seconds. So his pulse rate for the first 30 seconds was 34 times 2, which equals 68. And then his respiratory rate was 13. So Dayton, I'm going to be teaching you how to take your own heart rate. In order for you to do that, I want to take your 2 fingers and place it on your wrist on the outside underneath your thumb right here.
Mm-hmm.
Okay? And I want you to count for the next 30 seconds. You feel that pulse?
Yep.
Okay, perfect. So for the next 60 seconds, I want you to just count in your mind. All right? And
Okay.
count it out.
Okay.
All right, ready? 3, 2, 1, go. All right, time's up. What heart rate did you get, Dayton?
68.
68? Okay. Now I will confirm that by taking it as well for the next 60 seconds, okay? And time. So after 60 seconds, your pulse rate was indeed 68. For this next one, I'm going to be doing a cardiac auscultation exam. First, I'm going to be finding your aortic area, which is in the right second intercostal space. Okay, right about here. And I'll be listening for your heart sounds. And that one sounds normal. Next, I'll be going over to the left second intercostal space for the pulmonary area. The heart sounds normal there. Next, I'll be going down to find the tricuspid area, right in the left sternal region, just at the fourth intercostal space. The heart sounds normal there. And now I'll be coming lateral to the mitral area or the apical area, right at the fifth intercostal space. And the heart sounds loudest at that area and also normal. Next, I will be performing the peripheral pulse examination. I'll be finding the dorsalis pedis on the anterior foot first. It'll be in this region right here. And to confirm, I'm going to have the patient lift up his big toe. And it'll be right next to the flexor hallucis longus. And I can feel a palpable pulse. I would grade that as normal, 3+. Next, I will be finding the posterior tibial artery, which is behind the medial malleolus, right inferior to that. And I'll be placing my hand in the back of his foot. And I can feel a palpable pulse here. And I would grade that as normal, 3+ as well. Thank you for watching.